This assignment is Improvement by Design, prepared by Hirt in requirement of HAP 360. EHR, it isn't just magic. So, commonly assumed claims of installing an EHR are that they improve the quality of care, make clinicians more accurate, and patients more informed. However, the issue is how to improve work processes is not specified. The unfortunate truth is that process improvement is often an afterthought. Money, time, and effort spent does not produce desired results, and previous problems are still present. The solution: carefully analyze what the client needs by asking organizational leaders, carefully evaluating the tasks and processes. The careful design and use of databases is really important in creating an effective EHR system. Each column is referred to as a field, and each row is referred to as a record. Each value is referred to as a data value, and the table can be referred to as an object. So a little bit more on the relationships between different tables. So as you can see, highlighted in blue is the student ID number, and these are often called keys, primary keys or secondary keys, as the class ID is a secondary key in the table takes course. So the relationships between different tables really assist in allowing the actor, the person accessing the database, to be able to identify or query specific information from the tables or the overall database. So by having relationships between different tables, you can access a variety of information. So the assigned project for this week, the objective is to analyze necessary information a healthcare provider would need to manage the care of a depressed patient utilizing genetic information. So a few assumptions before we really tackle the problem. The patient is seeking treatment for depression for the first time, so they aren't on any current medication. The patient first visits their primary care physician. They're prescribed an antidepressant medication, and they're referred to a psychiatrist, and the patient already has a pharmacy in place. So the patient's first call to the primary care physician will result in a variety of information being acquired. So as you can see on the far left, we have a patient ID, which I noted as the key for this particular database or component of a database. So you'll have the name, the date of birth, the insurance provider, the address, and as you can notice, the name and address are divided up into categories, which can also assist in narrowing down the a query and assisting in finding that or gathering additional information. So it would also include the phone number, the reason for the visit, and the primary care physician assigned to that patient, as well as the next appointment date. So the patient's first visit to the primary care physician would consist of acquiring additional information, including the blood pressure, heart rate, weight, height, temperature, current medications they're on coming into the office, symptoms, lab results that are acquired, the diagnosis, prescribed medication, and the treatment plan, and also a referral to any outside doctors. So in our case, this would be a referral to the psychiatrist. During the first visit at the primary care physician, the physician will evaluate the patient and gather necessary information in order to make a diagnosis, prescribe a common, often well-tolerated antidepressant that must be in the patient's system before genetic testing. So a little bit of the research that I found indicated that genetic testing can assist greatly in making sure that a medication provided to the patient doesn't result in severe side effects, but also it can assist in diagnosing how quickly the patient processes the medication or metabolizes the medication, which can prevent overdosing, or even if the patient processes or metabolizes the medicine too quickly, the medicine won't be effective. So it could be that the patient needs a higher dose or a lower dose depending on their metabolic rate. So the antidepressant would need to be in the system before genetic testing, and there are some well-tolerated antidepressants that have a record of having very low side effects. The physician would also recommend a follow-up appointment in 2 weeks, refer the patient to a psychiatrist for counseling and the final prescription decisions, give instructions to report side effects immediately, and the pharmacy receives the patient information and fills the prescription. So the patient's first visit to the psychiatrist would consist of gathering more in-depth information on the patient's symptoms, to begin talk therapy, possibly even with a different member of that private practice, so maybe even referring them to a psychologist for the talk therapy, and to explain the benefits of genetic testing. So psychiatrists are often or can be more well-versed in the genetic testing and how it relates to the specific antidepressant that they would recommend for that particular patient. So the patient's second visit to the primary care physician would result in, again, taking vitals, again, gathering information on how the medication and the therapy is working, so kind of like an overall checkup. Taking the biological sample for the genetic testing, which could result, or which could be a blood test or a swab in the inside of the mouth, things like that. And to advise the patient to continue to seek therapy and report any adverse side effects. Recommend setting up an appointment with a psychiatrist in 8 weeks to discuss the lab results. So in the patient's second visit to the psychiatrist, they will explain in detail the results of the genetic test and recommend a particular dose and medication based on the lab results. So that could be maintaining the same medication, adjusting the dosage, or maybe prescribing even a better medication that would be more suitable to their genetic makeup. So here is the documented use case. So the use case would be management of care of depressed patient using genetic testing. The overview would be the purpose of this use case is to allow healthcare professionals to make more informed decisions on patient care using genetic information. The primary actor would be the primary care provider, and the secondary actor would be the psychiatrist. The starting point would be the primary actor refers patient to secondary actor and orders the genetic test. And the ending point would be using the results from the genetic test, the secondary actor prescribes the optimal dosage and medication to the patient and adds information to the AHR to allow the primary actor's monitoring. The information exchanges involve the primary actor and secondary actor sharing records containing basic patient information, vitals, notes on progress, and therapy. The measurable results would be the updated patient information is added to the records and the primary actor is notified of the psychiatrist's prescription. So this is the data that is shared between the primary care provider, the pharmacy, and the psychiatrist. This is the workflow, which we kind of discussed, but it's just like an overview, which consists of the primary care physician to the pharmacy and kind of back and forth, and the final result being that the patient gets the new prescription and the primary care is notified of the psychiatrist's expert opinion on the patient's needs, and the primary care physician is able to continue to monitor the patient's overall health care. So the overview is that this process describes the information that is necessary for the EHR and when the best time to acquire that information is, who needs what particular information, like as for instance the pharmacy didn't really need a lot of the information that the primary care provider and the psychiatrist had. By sharing information, time is saved for both the patient and the healthcare provider, and utilizing a genetic test, or how utilizing a genetic test best fits into the management of a depressed patient's care. Thank you, and I hope you have a great day. And these are my references, just in case you would like to review some of them. And thank you again.